We have several hundred employees on quarantine, so we're watching that carefully. I will say that on the vaccine side, we've seen an uptick in vaccinations. Kathy is saying you guys might end up having the exact numbers, but I would say that we've seen an uptick in vaccinations in the past week, both from our employees. We're almost to 63% on first dose, but also in our community vaccine sites that we have around the region. So we're optimistic about that. The staffing challenges are real. We're concerned about that, and frankly, it's a challenging situation. As you know, just to give you kind of going back, a year plus ago in April of 2020, we had over 1,000 COVID inpatients. So we're not near those levels, but the increase once again over a month ago is 700% increase. So Robert, I'm going to stop there for a minute, and I guess the one other thing I could talk about is just the protocols for our employees. So we've been asked about mandatory testing, as we indicated. Mandatory vaccines. Sorry. We support the mandatory vaccines. We will do that when the vaccine comes off EUA. And in the interim, what we're doing is moving to a new protocol of unvaccinated employees will wear N95 masks, and we also will move to weekly testing of our unvaccinated employees. So those are two protocols we have put in place, and we continue to review and modify our visitor policy as needed. So with that, Robert, I'll turn to you to see if you got other comments, and or Sandy and Kathy. Love to hear from you guys as well. So.
Yeah, I would just add that our numbers, the rapid rise in the numbers, we're certainly, if you look at our hospitalization numbers, we're above where we were in the second peak last year, and approaching where we were in that third peak. Again, nowhere near that first one that Warner mentioned when we had almost 1,000. But these numbers are going up, and our concern is, remember before, of course, the state was locked down. There were a lot of measures taken, and still a lot of people not wearing masks. So there is concern that these numbers may not tamp down maybe as quickly as they did in the second or third surge. So we're watching that very closely. The other thing to keep in mind is we were during the earlier surges, we had people when surgeries were very limited, we were able to redeploy people to other areas of patient care. I would also add, I think it's important to know that at that time, and we've talked about this before, early on with the pandemic, New Orleans and New York were some of the hardest hit areas. The rest of the country was fairly spared. So there were a lot of available nursing staff around the country that we were able to bring in. Now with these surges everywhere across the country, that staff is less available. So we don't have the, I would say, reserves to go to like we had before. So as Warner said, we've had to look at dialing back some of our surgeries, making sure that we're being very conscious of not using up additional beds from patients that post-operatively. So that means putting off surgeries. So we have room for all of the COVID patients. So, and one of the takeaways here is that it's not just affecting the COVID patient and those that choose to be unvaccinated. This is now beginning to affect those that are vaccinated, who want to be protected, but are having care perhaps put off because of the surges and some staffing issues. So I'll stop there a minute.
Yeah, Robert, just two other things. So I know there's a question about vaccinated for the folks that are on quarantine, are they vaccinated, unvaccinated? I don't have those numbers. I do not have the numbers of the folks that we have on quarantine, whether they're vaccinated or unvaccinated. So I do not have that. On the vaccine side, the last 2 weeks we've done 10,089 vaccines, up from 8,000 the 2 weeks prior to that. We've had many coming to our mall sites. We've also seen an uptick in our employee population over the past 3 days, and we're hopeful that that will continue to escalate. So, I know there's a comment about, we will have a different badge holder situation for folks that are vaccinated. We're asking our employees to report their vaccine status over the next couple of weeks. So we moved to this new protocol of the N95 mask and the weekly testing. So the other thing, Robert, I don't know if you want to hit is just as far as, we had asked about ICU beds and that sort of thing. We're fine on ICU beds. This is not an escalation of patients going to critical care. It's really patients we're taking care of in our medical surgical areas. And once again, we covered this before, but if you go back to the early surge 1 back in March, April of 2020, about 10-15% of the folks were 50 or under. What we're seeing today is about 40% of the people that we're seeing in the hospital are 50 and under. So this is absolutely hitting the younger population. On the upside, they're not having to go to the ICU the way we saw a year and a half ago. But I think we also need to understand that probably about 90% of these folks, if vaccinated, would be home. And I think you need to keep pushing that this is absolutely disproportionately hitting folks that are unvaccinated. Those are the folks that, in a very high majority, we're seeing come to the hospital. So anyway, we'll stop there. And Robert or Kathy or Sandy, happy to, anybody else has any comments?
Yeah, I might add on to the conversation about the ICU. We have now not the first surge. The first surge was a little bit different, but in the other surges, when they jumped up, we saw initially big hospitalizations on the medicine floors, and then over time seemed to see more go into the ICU. So we're still very wary that even though, for instance, here at OMC, we have a very minimal number of those patients in our ICU. But if you look at some of our other campuses that seem to be surging a little ahead of us, that percentage of ICU patients is a little bit higher in those facilities. So we are keeping a close eye on this, but it is good, to Warner's point, that a larger number of these patients, if we had to look on a good side, larger number of these patients are younger, don't have as many comorbid illnesses. But unfortunately, some of these older patients still, between their age and other illnesses they have, put them at a very high risk of getting very sick with this.
Dr. Hart, before I turn it over to Dr. Baumgartner, Dr. Kimmerly, can you give the breakdown, I know by region, of our hospitalized patients?
Sure. Let me get that for you, for those of you in different locales. So in Baton Rouge, we have there's 43 patients there, and that's up from 30 from just a week ago. In the Bayou area, 69, up from 39. In the greater New Orleans area, 201, and that's a 100% jump from just a week ago. Lafayette has 90, up from 54. North Louisiana has 33, up from 24. And in the North Shore region and Hancock are up to 112, and that's from 70. So you can see we've got anywhere from 50% to 100% jumps just in a week's time period in some of those areas.
The other thing I was going to say, Robert, we can go back and calculate the unvaccinated percentage at each of the regions. I know there's probably a little variation by region. So we'll go back and take a look at that. And Nicole, we can get that to you so you can share it with our friends with the media.
All right, thank you. Dr. Kimmerly and Dr. Baumgarten.
I'd just like to say that, again, as Dr. Hart and Warner mentioned, what we're seeing in the hospital are people on the medicine floors, not in the intensive care unit, but they are younger than they have been in surges past. So as we mentioned, primarily in the unvaccinated individuals. So we've learned a lot in the course of the last year or so in treating this disease. Our treatments are better, the outcomes are better. And so it's not as completely chaotic as it was in the past, but certainly it feels very different in the sense that we have better treatment and we know, better how better to take care of these patients.
All right. Dr. Baumgarten, anything you want to add before we go on to some questions?
Sure. In terms of adding to what Dr. Kimmerly had said, when we look at the beginning of the pandemic, the average age of our patients in the hospital has decreased by about 10 years. So average age is about 53 now. I think in the chat, there's also a question about children. And so we are seeing increased positivity rates of children in the community. We, over the last week, have seen a positivity rate of 21.4%. That's up from 16% last week and 7% in the first week of July. And this does show that we need to protect our kids by continuing to increase vaccination in adults and those around them, and continue to protect by wearing masks in those situations where people are at risk. We have not seen a great number of kids hospitalized due to COVID. We do have scattered cases here and there. We are continuing to see RSV as well, though, which impacts our hospitalizations in children. So primarily what we're seeing in our hospitals among children continues to be RSV. And we continue to partner with schools and the state on vaccination of any that are able, ages 12 and above. And we're partnering with many schools and school districts to get vaccinations done for kids.
All right.
Nicole, just two other comments I make, and we could use the media's help around this. So now, just looking at the latest stats, almost 4 billion vaccine shots have been given in the world. 4 billion in the world, 3.97 billion, 343 million in the US, 163 million fully vaccinated. The misinformation and the confusion about this vaccine that's out in the world, and then the stories and the wrong information on social media is absolutely terrible. This is a safe vaccine. We've given it around the world almost 4 billion shots. That is an extremely large clinical trial. We're not, this had an incredible clinical trial when it was done, and it was deemed to be safe. And that's why we started distribution across the world. So we've had meetings with a couple thousand of our leaders on Monday, several thousand employees. And it's amazing, even for folks working in healthcare institutions, the misinformation and the misunderstanding about what this vaccine is, how it impacts you, and how it works. So we could really use your continued help to get the message out, the right message, the facts around the safety of this vaccine, and the fact that people are dying every day because they're not vaccinated. That's the reality of what we're having. And people are coming to the hospital every day because they're not vaccinated. So we need your help around this situation. It is absolutely critical. And the reality is there's so much misinformation and mistrust out there that it's undermining the positive impact that this vaccine can have on the public. We've got thousands and thousands of doses of vaccine we can give to people. We just don't have people that want to take the vaccine.
Well, Warner, on that note, I'm starting to look at the questions. I know we've answered some on capacity and given our regional numbers, but Brianne Bazette with WAFB in Baton Rouge Most who are unvaccinated say the reason why they don't want to get the vaccine because it has not been FDA approved, or we don't know all of the long-term effects. How does that make y'all feel considering we are in a fourth surge?
Yeah, so I'll hit one comment and then I'll let the physicians. So 60 medical societies came out at the beginning of this week. 60 medical societies came out in support of the vaccine. Do we think for 1 second that 60 medical societies would come out in favor of the vaccine if they didn't think it was safe? Now, I can't comment on why the FDA hasn't cleared this yet, and I'm not privy to it. We don't have line of sight into when it will be approved. What we do know is, just looking at our own numbers, this vaccine is saving lives and keeping people out of our hospital. That's what we do know. And the other thing we do know is that folks that get COVID, even moderate cases of COVID, have ongoing chronic disease issues, about 20 to 30%. So the risk of having ongoing chronic disease or other medical issues from COVID versus a vaccine is a multiple worse, absolutely worse. And so we need folks to understand that there is risk in getting COVID as far as ongoing health issues with everybody that gets COVID, 20 to 30%. And the folks that are getting the vaccine, we are not seeing the adverse effects or whatnot. I mean, yeah, there's some folks that, you know, have some side effects or have some fever, chills, or have a sore arm, but we're not talking about ongoing medical issues for folks that are being vaccinated. So Sandy and Kathy, you guys are much more educated in this area, but just from a layperson's perspective, the misinformation is dangerous. It literally is dangerous.
Yeah, I would agree, Warner. And, you know, we've looked at the data, we've looked at the science, we've fielded all the questions. And despite all of the best efforts from all of us, what sticks on the internet seems to get stickier and perpetuate. And so we need your help in speaking the truth. And as Warner mentioned, you know, this disease is not benign. And we really, really need people to get vaccinated so we can just stop. And even if everybody got vaccinated today, this week, we'd still have 4 to 6 weeks of continued cases because it takes that long to get immunity. So it's paramount for people to get vaccinated and to not be afraid of the vaccine, because COVID can be a scary, scary disease.
I would just add to that we have, as Warner mentioned, 548 patients in our hospital across the system due to COVID. We don't know of any in the hospital right now due to a vaccine. So we know that the vaccines are safe. We know that COVID is what is killing people, all ages. You know, we've had patients as young as 19 that have succumbed to COVID. Elderly patients in between. And these are patients and people in our community. They're people's family members and loved ones. And we can make a difference by getting a simple vaccine. It's a simple thing to do. There may be side effects. They're temporary, they go away. This vaccine has been scrutinized. It's been reviewed by the FDA, the CDC, ACIP, and now 60 societies have come out in favor of it in the medical community. How often do we see 60 societies agree on something? We all agree on this. The vaccine is what's going to save lives and keep people out of the hospital and keep people from dying. That's the only way out of this. So we are passionate about it. We are continuing to share this message. I know that you've heard it over and over and over again, and I feel like people have heard it over and they're tired of it. But we continue to see people in the hospital that have not gotten vaccinated, and then they are in the hospital, they have long-term effects when they go home, they may die despite everything that we do. And the only way to prevent that is by getting a vaccine. So we need to all be sharing that message, each and every one of us. We have a neurosurgeon here that is vaccinating and trying to improve vaccination in each one of his patients, a neurosurgeon. You know, all of us need to be doing this. all of us as physicians, as people in the community that know the data, we all have to dispel the misinformation and continue to push this message. Thank you.
All right. Thanks, y'all. Next question, Emily with the Advocate. I know Dr. Baumgarten, you shared, she's asking what are the hospitalization numbers among children? I know we shared the updated positivity rates, but are we seeing hospitalizations for children for COVID?
We are seeing them rarely. We have not seen an increased number at this point, but we've seen spotty admissions, meaning we've seen admissions here and there with children. So we are seeing them, yes.
Okay.
But just to be clear, we're not seeing those kind of rises like we're seeing in the adult population. The positivity rate has certainly gone up, but we're not seeing those children come into the hospital like that.
Okay. All right, Shalina with NPR and WWNO. Some states like Mississippi are recommending booster shots for the immunocompromised. Do you think that's possible in Louisiana when people can't even be convinced to take the first shot? Do you think the employers like hospitals will and can disincentivize not taking the vaccine?
So I'll comment about the boosters. Mississippi did, in fact, notify its citizens that if they were immunosuppressed, they should take a third shot or booster. The FDA and CDC has not made those recommendations. We're continuing to follow that. I know Pfizer made a news splash today for a report, with their earnings report, with their third booster shot and its effectiveness against the Delta. But however, we as an organization are following the situation and will recommend boosters when FDA allows for that in the EUA.
I think I'll just add on, I don't think it would be surprising at some point that boosters are recommended, but just to get it a little bit to your question, your question really hits on two different populations, because there will be a population out there that's going to say, I'm very willing to take a booster if it gives me more protection. And I think the longer we, certainly in Louisiana, with our low vaccination rates, there may be another variant come along that causes problems. And so there may be another booster that may be more aligned with that particular variant. But then that other population is going to be that population that heretofore is just saying, nope, not going to take the vaccine. Whether we do a booster or not probably isn't going to have any influence at all on that particular population.
We are getting questions from both Baton Rouge and Shreveport regarding elective or postponed surgeries.
Yeah, Robert, I have not heard of us delaying in those markets as of yet. Have you?
Baton Rouge is looking to put off some surgeries, yes. I haven't heard of anything in Shreveport, but I know Baton Rouge is looking, just like we are, they're looking at the schedules every day, looking at the volumes in the hospital to see what might need to be pushed off. And they are looking at needing to push off some of those over the next week.
So really that'll be a case by case situation by facility as well.
It is,
correct?
because every region is a little bit different, and they have different staffing issues and different bed capacity. And so we're looking at those. Our surgery groups are looking at those every day, deciding what can be done the next couple of days. Yes.
Okay, a question from Emily with the Advocate. I saw you're requiring an ID badge holder that identifies vaccinated employees. What should patients, especially the immunocompromised, do if they don't want to be treated by unvaccinated employees?
So I would say one reason we're doing the colored badge holders, remember at certain times of the day, let's say shift change, that sort of thing, we have large volumes coming in and out of our facilities. And so in those areas where we have the intake areas, We want to be able to quickly identify our employees who have been vaccinated and those that don't, because the ones that don't are going to need to be wearing an N95 mask in the near future. And so it's really a way to just quickly visualize and identify. For patients asking for, because I think it's a great question. We've had more and more patients, and I think this is going to grow over time. More and more patients asking about, is their care team vaccinated? One, we are doing everything we can to get every one of our employees vaccinated. Two, you got to remember, we are following all the CDC guidance thus far on how to safely take care of patients. We're doing all those things. We're making sure we're wearing a mask, good hand hygiene, socially distancing when possible. But I think that's a great question for our patients. And I think to Warner's point, that's why 60 organizations have come out, and multiple other groups around the country have come out in favor of mandatory vaccines in healthcare personnel. Warner, I don't know if you have anything else to add to that.
No, I think it's, certainly, I think the other reason is so that we can identify folks and make sure they're adhering to our N95 masking requirements and whatnot, which we believe, for those that are not vaccinated, is the best alternative to keeping everybody safe.
And we will try to accommodate a patient that asks. Just, we have to keep in mind that sometimes we may not be able to provide that accommodation to a patient. But again, we would be following all the CDC recommendations on healthcare.
There's a question, Nicole, about, have we taken transfers? We take transfers every day. I'm sure that we've had to decline some transfers, but more than likely we've taken transfers from outside the market. So the New Orleans numbers more than likely include people not just from New Orleans, but transfers we've taken outside of the marketplace. As far as the updated vaccinated employees, fully vaccinated, we're still 61%. We're closer to 62.5% on first doses, according to the numbers I was looking at earlier today. So we are making some progress there, but we got a lot of work to do.
Okay, and I'm being mindful of time as we have less than 10 minutes left to go. Rosemary with WWNO, we are doing our best to regularly give y'all information with the data of vaccinated and unvaccinated patients in our hospitals. So we're committed to at least one weekly media briefing going forward, and we're trying to do more. But knowing that our teams are busy taking care of patients, we're trying to be mindful of all of that as well. So we're committed to at least once a week and giving all of that data. I see another question about, we are concerned about staffing shortages. I feel like we've talked about that a lot thus far. We've talked about children and hospitalizations, but a question there, are we seeing an uptick in vaccinations in the 12 to 18 age range? I don't know if we've seen anything.
I don't have that specific data. I don't know if anybody else has that specific data.
I have not seen specific data in that age group, no.
Rosemary from WWNO, Dr. Kimmerly, can you talk about current COVID treatments? I've been told from some people that better treatment is an argument not to get a vaccine.
That's a tough one in the sense that that's not a great reason to avoid getting the vaccine, because again, these treatments are not curative. We know that steroids helps with the inflammation. We know that remdesivir decreases the amount of virus. We know that the monoclonal antibodies given early on in the disease are beneficial to stop hospitalizations and hopefully prevent deaths, but none of those work nearly as well as the protection afforded by getting the vaccination.
Okay, I'm trying to get through some of these as I'm going through the list. I think, Warner, another question or to give more detail about the misinformation and distrust staff expressed during the meeting on Monday.
I think it's all the same things that you guys see out there on social media. The questions about the impact of the vaccine on fertility, which are unfounded and not true. The comments around, death and other medical issues related to getting the vaccine, not true. Dr. Baumgartner's comment about 548 people in our hospitals with COVID, 0 that have side effects that, have putting them in the hospital, 0. Can't get any lower. Those are some of the components. And some folks that they worry about long-term impact. And once again, and they say it's, this is new, it's just kind of been created. The mRNA technology has been around a decade plus, especially around cancer therapy. So this is not a new situation that was just created. That technology was used to create the vaccine and create the response. Yes, but this isn't about you're injecting the virus into your body. It doesn't work that way. The Moderna and Pfizer vaccines do not work that way. So I think generally, and I'll ask our physicians a comment, I think the safety around Moderna and Pfizer is likely safer than what we see around flu vaccine generally. But there's this misinformation that just gets trumpeted over and over and over on social media, and it just is damaging, and it is under, it's eroding confidence in this process, and our numbers will keep going up if we don't do some mitigation strategies. I mean, my guess is we're going to be going back to masking, in a broader sense. You saw the new CDC guidelines that just came out, so it's we're going to have to do things like that immediately to mitigate some of the escalation we're seeing in cases.
Okay.
There's a question about, if 12% of patients are vaccinated, does that mean the vaccine's not effective? No, doesn't mean the vaccine's not effective. It does mean that there's, there are cases that happen. So Robert and Sandy and Kathy, I'll let you guys hit that one.
Yeah, so we know the vaccine, when the vaccines came out, they were touted as being 94-95% effective. Okay, so just right off the top, if you give 100 people the vaccine, 5 of them could still be susceptible to the virus. Over time, what's happened, because the vaccine rates have been so low in our communities, new variants have come in. Those new variants aren't quite as responsive to the vaccine as they were originally. So when you take that into account in larger populations, you are going to get some of these breakthrough infections. But it's not because the vaccine is not effective. It's doing what it's supposed to be. It's a little less effective than it was against the original alpha, the original variant, the original virus. But again, I think we've got to step back and realize that we're here today because our vaccine rates have been so low that this virus has evolved and mutated to become a little more transmissible and more problematic than the original virus. Again, leading us to the conclusion that we've got to get more vaccine out there.
Okay, we've got 2 minutes. So Dr. Kimmerly or Dr. Baumgarten, anything else you'd like to share, and then give Warner it to wrap it up?
I'm good.
Okay.
Nothing additional.
See the comment from Mark, if only 60% of the hospital workers are vaccinated. They're on the front line. So a couple of things. One, in our physician ranks, I think it's 90 or over 90%. Two, I think we have a lot of women of childbearing age at Ochsner, and they see a lot of the misinformation out there around fertility. And that's being, multiplied multiple times on social media. So that is definitely a challenge for us with some of our employees who are, women of childbearing age. I think the other piece we have a lot of people that are working remote now that are still just staying at home. And I think there's challenges of vaccination of some of those folks. We want all of those workers vaccinated. So it's, that's kind of what we're seeing. It is, but once again, it does vary by region of the state. It does vary by region of the state. And so certainly in the southern part of the state, we see much higher vaccination rates than we do in western and northern part of the state. So has LDH or any other state agency requested that you look at open up more beds? Not at this point. The issue is not bed capacity. The issue is people. We got to have the people to staff the beds, and that's the challenge right now. Is we have ORs over Ochsner Lafayette General that we've closed. We got the ORs there, we just don't have the people to run them, so we've had to close ORs because of not having enough staffing. So staffing is the biggest issue, really not having the physical locations and beds to take care of folks.
Just a quick comment.
On elective surgeries, we are. I mean, that is a balance every day that we look at. How many COVID patients do we have and then get admitted? How many? We want to do as many surgeries as we can. We don't want to delay surgeries. So it's a balance every day. Right now, we're accommodating all of the COVID patients that come to us. It's not like that's not happening. So we're accommodating all the COVID patients. We're adjusting the rest of our clinical work to make sure we can take care of as many people as possible and take care of 100% of our COVID patients.
I know we're at time, but the last two pieces on EUA I think are important. So one, explaining how COVID medication is under EUA like the vaccine is, and a little bit more comment on the EUA designation. It was created to get this kind of vaccine out in an emergency, but people use it as an excuse to not get the vaccine.
I'll let Dr. Baumgarten take that.
Right. So there are some medications that are now FDA approved. Remdesivir has been FDA approved. And then dexamethasone we use is a medication that is not under EUA, but we know that it works from data and clinical trials. So that's why we use it. The monoclonal antibodies are still under EUA, and we do use those in patients that are diagnosed with COVID in high-risk categories. Very soon after their diagnosis is the best time to use it because we're giving passive treatment to patients. So yes, there are still some things that we do that are treatments that are under EUA. Not everything is, but there are many. The vaccines have been given to billions of people across the world, to millions of people in the United States. It has been under the most scrutiny of any vaccine ever in the history of mankind, of infectious diseases. And so we are comfortable that the vaccine is safe with all of the data that has been examined, with all of the clinical trials that were done, with all of the scrutiny by the CDC, by the ACIP, by the FDA. And so there is no doubt that the vaccines are safe and effective, even though they are still under EUA. Hopefully, we will see the FDA look at the data, examine the data, and quickly approve the vaccines. We just don't know when that will be.
Okay.
Kathy, just a quick question for you. I feel like I'll be part of the media now. I'll start asking you questions, okay? So on the monoclonal antibodies, which is under EUA right now, when people have COVID, I mean, are they turning that treatment down, or do they want that treatment?
Many of our patients want that treatment. We do have isolated cases where they may turn it down, but many who have not been vaccinated want the monoclonal antibodies when they get COVID.
I think that the other thing I want to just add, just to kind of give people a context here on vaccines, because we hear, oh gosh, it's a new vaccine, I don't want to use it. And some of it's about the technology, some of it's about COVID-19. People need to realize that every year when the flu shot comes out, that flu shot is usually composed of 3 different strains of flu. Now, one of those strains may be brand new in that particular year. And people take it, right? As soon as it's available, they take it. They don't say, well, I'm going to wait 5 years and let's see if this is going to work or not. No, they take the flu shot. But there may be a new variant of the flu virus in that vaccine every single year, and people willingly take it as soon as it's available. And here we have a technology that's years, decades, 20 years in the making for a safe vaccine, and there's this hesitancy that is baffling to many. So just something to think about.
And one last thing, just Nicole, that I'd throw out there for folks to think about, because there's a lot of, once again, it gets back to the misinformation. I saw a comment about, we seem frustrated. We're not frustrated. We're worried. We're worried because this is continuing to escalate, and we don't see the uptake in the vaccine, and it's, once again, it's a personal decision. We have to understand now we're getting to the point with this surge that it's starting to impact other people's medical care, and it's amazing how many people, when they get in the hospital or they get really sick, they're like, oh, I wish I had taken the vaccine. I mean, it happens all the time. So we're just trying to help people understand the gravity of the situation, because we can prevent people from getting COVID, right now, if we get more people to get vaccinated. And so, it's not that we're frustrated. I'm frustrated with the misinformation out there. Absolutely. I'm very frustrated with that. And as I said before, I think it's dangerous. But at the same time, we're worried about, where we are today and how this is escalating. And we could use your help in getting the message out that around vaccinations and, once again, about taking precautions.
All right. Well, thanks, everybody. We're over time. We appreciate you joining us. We'll follow up with some of the information in the recording. And again, we'll be looking to do one again next week and trying to answer some of your questions in the meantime. So thanks, everybody, for your time today.